I'm Dr. David Schreiber. I'm a radiation oncologist here in Rancho Mirage, California, which means I treat cancer with X-rays. My subspecialty is putting radioisotope inside tumors, and the tumor I work with exclusively these days is prostate cancer. Okay, my shoulder injury is a chronic injury. I've been weightlifting since I was 10 years old, so many decades, and over time my left shoulder wore down because my left arm, unbeknownst to me, didn't extend as much as my right arm, and over time it changed the way the weights affected my body. And eventually it wore down to the point where I had to have a shoulder surgery with an arthroscope, where there was some repair of what's called a slap lesion. And then over time I wore down the cartilage further and got a lot of bone spurs to the point where it was not salvageable anymore. Before the surgery, my shoulder caused me a lot of discomfort and inhibited my activities in the operating room, at work, at home, lifting objects, doing everyday tasks at home, such as screwing in a light bulb even, opening a drawer, flying my aircraft, reaching for the radios. These were all impacted, and just putting on clothes in the morning, reaching around the back to put my belt behind the belt loops and things like that. Because I'm a physician and I like to direct my own care, I like to do lots and lots of research before I decide on any therapy for myself. I saw many orthopedists in consultations. Some people here in the Valley, they do reverse shoulders. They want to do reverse shoulders on everybody. There was no way I was going to have a reverse shoulder. That would limit my motion and would limit my weightlifting ability, and I didn't want to do that. And I was searching for just the right fit for me. But then finally, I was on the internet, but I found the Arthrosurface website, and I called Arthrosurface, and I said, who started this procedure? And they said, Dr. Miniacci, the Cleveland Clinic, and I went out there and had the procedure very rapidly. The day of surgery, Dr. Miniacci spoke to me, took me back to surgery. It was very quick surgery. And then I woke up, they checked that I had my nerves all intact and my muscle motion was normal, and it was. So they gave me my block, and then it was painless after that. I chose the Arthrosurface ovomotion with inloy glenoid procedure because it seemed to fit the bill for me, okay? It didn't require a limitation ultimately of any activity that I wanted to do. And I do a lot of activity. I don't just weight lift, okay? That's just one of the things that I do, but that's probably the most strenuous on a shoulder. But if I'm going to go skiing, scuba diving, I got to put a tank on my back, flying, reaching for radios, in the operating room, positioning patients, all those kinds of things. I didn't want to be limited in that activity. My range of motion was so limited before, I didn't realize how limited, because you don't feel like that you're only going this far, okay? But like after the surgery, the range of motion zipped way up. And like I remember pulling my arm up like the first time in the shower and I hit the shower head with my hand, okay? It's like, oh, look at that, I can reach that high? I didn't even know I could do that. Before, when I was flying, the left arm was restricted and it had pain. A lot of the radio knobs are you reach up with the left hand, and that would always hurt me. And now I can reach up, I don't even remember trying to reach up. I don't have to put a mental effort into it anymore. It's just automatic. Thank you, Arthrosurface, for creating this ovomotion with inloy glenoid procedure, because this gave me my life back. It gave me range of motion. It took care of all of my pain, and I recommend it to anybody that's active that wants to have a shoulder replacement procedure.